Good morning.
Good morning.
Welcome to Plastic Surgery 90210. Today we are talking all about Play-Doh.
Play-Doh. Fun with Play-Doh day.
Yeah, we're talking about silicone removal of the buttocks. Dr. Katzen's going to show us how to do the open technique with Play-Doh for those of you that can't really handle the graphic content of your videos. So this will be really fun. But first, we're sponsored by our friends over at Fairgrounds. They're an amazing cafe 1 block away. I have a double matcha with oat. What do you have?
I have a double matcha too. You can see the double matcha at the bottom.
Yes.
Earl Grey with oat milk. It's so good.
Oh, this is really good. I think double's the only way to go from now on. That is so green.
So and you put the straw at the bottom so you get the matcha. Just,
oh my God. So we're going to see him feel this throughout the video. So exciting. So first of all, we hear a lot of different code names for silicone injections, right?
Yeah, so there are a lot of different names out there, maybe to get to you to feel more safe with the injections and maybe to confuse the customer. But code names that we hear out there for silicone injections include biopolymers, PMMA, things like that.
Liquid BBL.
Liquid BBL,
collagen.
collagen.
They even say hyaluronic acid, which gets confusing because hyaluronic acid is an FDA-approved filler, but sometimes they're mixing this hyaluronic acid or not even actually using hyaluronic acid, and they're using that illegal silicone.
Correct. So sometimes they'll say one thing and then inject something totally different.
Also, it's a little confusing because I feel like it's kind of a gray area for silicone injections and what is not allowed because they say you're not supposed to use it to augment large areas.
Correct.
But what does that even mean?
Correct. So large is kind of subjective, okay, but they're talking about usually the micro droplets that are injected into like acne scars. So that is legal, where we're just filling in little tiny indentations on the face. But then when we're talking about augmenting larger areas like the breast or the buttocks, that is not recommended by the FDA.
So it's okay to get it done by like a dermatologist or a plastic surgeon for like the acne scars, but when you start to augment more than that, that's when we start to see issues.
Correct. So when we're augmenting bigger areas, the buttocks, the breast, even the deeper facial structures, that's not FDA approved.
You've also seen many issues from these liquid rhinoplasties that are permanent fillers in the nose.
Correct. So the permanent filler shifts, it causes foreign body reaction, it also migrates off the nose, causing a whole host of problems. So we've dealt with a lot of cases that are really complicated to get rid of the silicone that was injected into the nose.
It's really sad. So say no to permanent fillers in general because they most likely will lead to
cause problems.
Yeah. Okay, so let's get on to our demonstration. You have 2 different ways of removing silicone.
Yeah, we have the closed technique, which basically is a suction, modified suction technique, where we suck out the product in the scar tissue. And then we have an open technique where we're actually making an incision to cut the product out and lift the buttock.
What are we going to be talking about today?
Today we're going to be talking about buttock with the open technique where we cut it out.
Okay, cool. Let's do it.
All right.
So Dr. Katzen, what do we have here?
So today we have a presentation for people that are graphically sensitive. We've created sort of this buttock and this case history of this patient that had silicone injection. So this patient had something injected into their buttock maybe about 8 years ago. And what the injector does is they draw up their PMMA, biopolymer, silicone, and then they inject it into the buttock. So what they do is they pierce the skin and they go in and then they inject their product. And sometimes the silicone will leak out of the skin, so what they do is they use super glue to sort of block that area to keep the silicone from leaking out. Until a couple of years later, when patients develop pain, a lot of scar tissue inside, redness, irritation, they bump that area, it causes a lot of pain, and when there's trauma to that area, that can cause bursting of the little silicone balls, which can then migrate down the back of the thigh, down into the foot and the ankle, and even spread into the lower back. So typically what we'll do is we'll get an MRI to sort of see what's inside, to see how much product there is, how much scar tissue there is, and the location of the product. So this patient was in so much pain in this localized area of the buttock and the low back that this patient required surgery. So what we do during surgery with the open technique is we make an incision typically in the upper portion of the buttock, sort of in the low back, sort of, my patients call it the little M, or the butterfly incision at the top of the buttock, and then we peel back the layers. So in this graphic, non-graphic presentation, the blue is representation of the skin. So as we peel back the skin, we have evidence of these little bobas that were injected. The analogy here is these little silicone balls are the silicone that was injected, surrounded by a lot of scar tissue. So right as we peel back the skin, we see this area of scar tissue impregnated all with the silicone.
So Dr. Katzen, the silicone goes in as a liquid and it becomes these bobas. How does that happen?
Correct. So the silicone goes in as a liquid, usually a clear liquid, and then the body reacts to the silicone by making a lot of scar tissue. Your body is trying to protect it from itself. Okay, so if you have some product injected, the body quickly realizes it's not you, and it makes all this scar tissue around the injection site.
How do those silicone balls migrate?
So I think about these like as eggs. So you have the product inside, that's the silicone, that's the yolk, and the shell is the scar tissue that your body forms to wall off that silicone. So with trauma, with like falling down or having impact to the buttock, those little eggs crack, the eggshell cracks, and that liquid silicone then can flow either through the lymphatic system or just from natural gravity spill down into lower areas of the buttock and even into the back of the thigh and even down into the ankles.
That's interesting. So that's how the silicone bobas are formed.
Correct.
Okay, got it.
So this representation is the silicone that was injected surrounded by the scar tissue, and this red area is a level of scar. So typically what the injector does is they inject the product into the fatty layer. That's representation of this yellow tissue. So what we primarily target is the silicone and the scar tissue, and it's usually in the upper third or the middle third, sometimes rarely the lower third of the buttock. Really depends where the injector injected it and the migration of the product. But usually the primary target is this fatty layer where the silicone was injected. So with our open technique, we target where the silicone is and the scar tissue, and that's where we position our scar. So on this patient here we have the muscle, which is nice and clean. There's no product that had been injected into the muscle. There's no product that had actually migrated into the muscle. And there's a little bit of debate as to how the product gets into the muscle. I believe it's just a thought that the product really can't migrate into the muscle because the muscle is so firm. The muscle is also covered in this fascial layer, which is this thick layer of tissue, and it's very difficult for a product to get through that fascial layer into the muscle. I believe the only way that product can get into the muscle is if it's actively injected with the needle during the injection period. And a lot of patients seek buttock augmentation because they don't have a fatty layer. So a lot of the injectors purposefully inject it into the muscle, and we know that because of our injector patients have told us that they purposefully inject it into the muscle so you get a bigger buttock. So it really depends on your injector, what they're doing, either on purpose or by accident, as to the product winding up in the muscle.
So there are lots of reasons why we shouldn't inject into the muscle. Even plastic surgeons used to inject fat for BBLs into the muscle, and we don't anymore. Let's talk about why it's so dangerous.
So the anatomy of the muscle is very, very important. In the muscle, there are arteries and veins, some pretty big arteries, pretty big veins. Arteries bring blood to an area. Veins take blood from an area back to the heart. So if the product is injected into the muscle and then subsequently by accident is injected into the artery, the product then is going away from the heart to the tissue, because that's what arteries do, and it gets clogged up in the capillaries. And if enough product is injected into the artery and with those capillaries become clogged, the tissue that artery was supplying gets clogged and decreases the oxygen delivery and can cause ischemia or tissue death in that area. So not a good thing. But what's even worse is when the injector is injecting it into the vein.
Is that why we've heard of patients who have had to have amputations to their limbs because of the silicone injections?
Correct. So you've heard of amputations of the limbs, typically from PMMA injections, and that's usually when the product is injected through the muscle and into the arteries, and then it causes that embolism or that blockage of oxygen delivery to distal tissues. It's much more dangerous if the injector injects accidentally into the vein. That's this white area. The white area takes, again, oxygen and blood back to the heart. So as the injector is injecting product into the vein, the silicone or PMMA biopolymer travels through the vein from a smaller vein to a bigger vein and then back to the heart and then lodges in the lungs, causing a catastrophic foreign body reaction. You're unable to breathe and you die pretty quickly after that. So it's very, very dangerous to inject product. It's very dangerous to inject it in the muscle, and it's extremely dangerous if it's injected into the vein. We often get questions of, Dr. Katzen, I was injected about 10 years ago. Is there any danger of the product getting into the blood vessels at this time? Pretty rare, because again, you got to remember the product's been injected and your body has made a lot of scar tissue around it. So the product is very unlikely to break free and then actually get into your bloodstream and then lodge in the heart or the lungs. So now you've seen the layers, and now you're going to see what we see in the operating room when we cut into it. So again, this patient is face down in the operating room. The blue layer is the skin. And when we make our incision, usually we're going to make the incision, the cut, as close to the product and as close to the scar tissue as we can to maximize the removal of the product and the scar tissue and elevate the buttock. So here we're going to make an incision in the top portion of the buttock with our handy dandy scalpel. And there are many layers, so we're going to have to cut a little bit deeper. And now I'll show you the cutaway here. So there is our cutaway of this patient, and these are the layers. Again, the skin, and sometimes the skin can become impregnated with the product underneath. Sometimes the skin, because of the product underneath and the scar tissue, loses blood supply. So sometimes the skin can get red as it loses blood supply. Sometimes it can get dark because the venous blood flow is getting congested. Sometimes actually the skin can die because it runs out of blood supply. So as we peel back the skin, again, we see a lot of this product, these bobas, these areas of scar tissue surrounding these silicone injections in the scar tissue. And then in a deeper layer, we see the fatty layer that was injected with the silicone and the foreign body reaction and scar tissue that it forms around it, creating these silicone balls. And in a deeper layer, another layer of scar tissue underneath the fatty layer. And even in this patient, we can see injection of product into the muscle. So when it's in the muscle, usually what I do is I try to remove it from the muscle as much as possible. I'm not taking out all the muscle. I'm just taking out little bits of the product and the scar tissue. My belief is your body is still going to make foreign body reactions to this product if it's left in the muscle. So if you just remove these upper layers and don't remove it from the muscle, I think you're still going to have systemic problems because your body's keeping track of the product that was injected in the muscle and keep on producing these antibodies, which can react either locally in the buttock, causing pain, or in your joints like rheumatoid arthritis, thyroid problems like Hashimoto's thyroiditis, or a whole host of GI problems. All right, so the first thing we do is we make an incision through the skin, and we go through the fatty layer, through the scar tissue, down to the fascia of the gluteus maximus muscle. So we make our dissection here all the way down to the muscle layer. But what I do is I go down through the skin, through the scar tissue, into the fatty layer, and just in the deeper layer of the scar tissue, and then I scoot just along the fascial layer on top of the muscle and disinsert the upper portions of the flap from the muscle beneath. So I go down as far as we need to go and remove the attachments and the scar tissue, adhering the deep scar tissue to the fascial layer. And once we get that disinserted, then I'm able to calculate how much tissue we can remove. And if there's product in the muscle like there is on this patient, we're going to dissect that out, remove that out. And then I'm going to be able to pull this tissue up and resect it. So in this patient, since there's product down to here, I measure how much product we can remove with these towel clamps. And then I make a counter incision down here, getting rid of the contaminated skin, contaminated scar tissue, contaminated fat. And there's our specimen that we removed. And then we're able to lift this up in a cosmetic fashion to get it closed. So sometimes there's a residual silicone in these flaps. So what I do is I make another little incision here underneath the flap and remove excess product and scar tissue in there. You can see some of that product is still left in the flap, and we just remove that little rim of scar tissue and rim of contaminated fat. And that usually allows us a nice adequate closure, so when we lift the buttock up, we're able to get that reapproximated like that. We insert drain on each side, and the drain stays in for a couple of weeks. So since it's liquid going in, usually with the open technique, we get rid of the majority of the product. We can never get rid of 100% of the product, but usually by far the majority of the product and the associated scar tissue is removed. The majority of patients, upward of 95% plus of patients, experience significant improvement in their pain, erythema, pain that goes down the legs, sensitivity, redness of the area. So it helps a significant amount by removing the product and the scar tissue.
A lot of patients are really happy with the aesthetics of how they look after the surgery because they get a butt lift out of this procedure.
Correct.
Their butts are really heavy coming in because it's so full of that scar tissue and silicone.
Exactly.
So
the most important thing, in my opinion, is to get rid of the product, get rid of the associated scar tissue, and that should relieve a lot of your symptoms, the pain, the irritation, the redness, the sciatica, the pain that goes from your buttock down your lower leg, the excruciating back pain as the product migrates up the back. So that's the most important reason to have the product removed. And then yes, we try to also focus on aesthetics during the primary resection to get the buttock restored in terms of shape and proportions.
So our awesome photographer Brian is going to ask us a couple questions. Go ahead.
So what's the recovery period like for an open surgery such as this, and if I'm interested in doing the reconstruction, what's the time frame like before I can get the reconstruction?
Yeah, so the recovery period for an open technique is typically we want you in Los Angeles for about 10 days, 2 weeks. Then you can go back home. If you have a sitting type job, maybe return to work at about a month or 6 weeks after. If you have a physically demanding job, you may want to take off about 6 to 8 weeks. It really depends on what your job is. And then in terms of reconstruction, every patient's a little bit different. Most patients don't need reconstruction, but if you're thinking about reconstruction, I would give yourself at least 4 months to heal after the open technique to determine if you need one. We have some patients after their surgery going, oh, I look fine, I'm good to go, I don't need anything else, and they don't need anything else. We have some patients right away after surgery saying, oh, I really want my bigger buttock back, and those patients will come back minimum 4 months later or more for reconstruction.
So if you or someone you know has permanent fillers in the butt, or you're not sure if maybe you do, give us a call.
310-859-7770.
You could comment below, or you could email us, scheduling@timothykatzenmd.com. If you mention this podcast on the Play-Doh silicone removal, we will waive your consultation fee. Then we'll get you an MRI, we'll see where the product is, and Dr. Katzen will help you determine if you need the open or closed technique. So if you have silicone injections, you are not alone. There are millions of people out there who also have silicone injections and who have gotten, unfortunately, and who have gotten them removed successfully. And they all feel so much better after the removal. So you will be okay, you just have to get it out.
Yep.
So thank you so much for watching. Please subscribe, and we'll see you next time.
See you next time. Thank you.